everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves. Welcome, everybody, to another episode of Airing Addiction. Thank you so much for being here. It's July. I'm really excited about this month's episode. So I'm Lisa Blanchard. I'm one of the co-hosts, and I'm going to turn it over to Jesse to introduce himself and talk a little bit about who we have here today. We've got kind of our biggest panel, I think, that we have had on this podcast. We've never had more than two. And so we're going to do our best to have a really great conversation about addiction and specifically in the academic space. So, Jesse.
Good morning, Lisa. Thanks so much. Yes, this is groundbreaking for the podcast, having such a big panel. And I, too, am really excited about this. I've been really counting down the weeks and days to have this conversation for many different reasons. So it's a mouthful, but I'm going to introduce everybody just briefly here so we know who we're talking about. And so first we have Lynn Leblanc-Marrone. She is a adjunct faculty at Anna Maria College. She is also the executive director of inpatient clinical services with Spectrum Health Systems. We have John Pratico, I apologize, John, the Dean of Psychology at Anna Maria College. And we have James DiReda, a full-time social work faculty at Anna Maria College. How did I do with those intros?
Great.
Beautiful. So this podcast came about from reaching out to a colleague who is also another professor at Anna Maria College. Shout out Lenore Rust. Thank you for putting us all in contact here. We were just talking briefly before we went live, the connection between Anna Maria College and Spectrum Health Systems goes back far longer than I even know. So we figured to come on today and have a few faculty as well as, dual faculty with Lynn here. So thank you, everybody, for joining us this morning.
Hey,
thanks.
And I guess to kick us off, and this question is for anybody, really, just to have a conversation starter. How have we been addressing students in sort of guiding them toward addiction work from the academic space in your respective roles?
Okay. I think I probably should defer to my colleague, John Pratico, because John has spearheaded most of what we've done at Anna Maria in an unbelievable way and taken the charge. And so I will let him tell you tell your audience what we've done.
Yeah, sure. That was a humble intro, Jim.
You know where to send the check.
Yeah, right. So at Anna Maria, one of the things we were talking about right at the get-go was that we've been around for a long time, and I'm actually an alum of our master's in counseling program at Anna Maria, and so I remember being an undergraduate student, psych major, and not exactly knowing how to find my way in terms of what did I want to do for a career. And part of that is just what it's like to be a college student. And some of that also has to do with the academic institution itself. So for me, when I got to Anna Maria as a grad student and took my first counseling course, I immediately felt like it was a good fit and felt like I knew that this is what I wanted to do for my career, which for me, I'm a licensed mental health counselor and a clinical psychologist in Massachusetts. And so I distinctly recall that experience in terms of like career advising and what it felt like to finally be sitting in a class learning to do what you want to do. And so at our college, we make a pretty concerted effort to kind of get that experience as early as possible in a student's career. So, Jim and I will be sitting at open houses with high school students, local and long distance. who are looking to kind of find their paths. And we're very deliberate about that as a college to help students not only kind of become whole people, grounded in the liberal arts, but also helping them find a career path that feels like it's a meaningful connection. A lot of our programs are very community focused, and obviously psych, social work, human services is no exception to that. So, for us, that's kind of the broad brushstroke of what I tend to do as the dean is I always joke with students, I don't really care whether they're a social work major or a psych major or human services, or we have a new major that's starting in the fall in addiction studies. And for me, it's like, I don't really care whether a student falls into one. I have no loyalty to one over the other, but I want them to find their path. I want the students to find a program that's a good fit. So that's really what we do, is kind of get students in a good position to then go from that foundation up, and the clinical training kind of takes over from there. Go ahead.
Yeah. Do you find that, so I've been at Spectrum for 23 years. I'm also an LMHC. I started school after working at Spectrum. Like I got my master's while still at Spectrum. And I definitely, I joke a lot when people ask, how have you been there for this long? How have you kind of been in addiction treatment for this long? And I kind of fell into it. Like I didn't get that experience in undergrad of being introduced to addiction as a part of human services and psychology. I really just ended up working for an outpatient program that merged with Spectrum and kind of fell into addiction treatment early on, then fell in love with it. And so do you find that that's kind of an important piece, is to introduce the concept of, addiction treatment as a path? Because, not everybody kind of comes to psychology, or social work with that plan, right? But often people kind of end up, whether it's through a practicum, an internship, they take an addictions course and they're like, wow, this is really interesting, or their own lived experience or their loved one's lived experience, and that's kind of how individuals end up working, in addiction.
Sure.
Do you find that that's the case?
Oh yeah, I would certainly agree with that. I'm gonna let Lynn and Jim both speak, because they both teach the addictions courses that you're talking about. So I'll hand it off to both of them. So
Okay.
And thanks. What I can certainly say is I've been doing this a really long time. And when I'm an LMHC as well. And when I was an undergrad, I did my first ever internship, had no idea. I was a psych major also, and did it unbelievably at a detox in the community I was working in, which was my first exposure. But when I went to grad school, there were no addiction classes. Yeah. Like that didn't exist. And I can recall in my at my practicum as a graduate student and in class, when people would look at the psychological dynamics, I was frequently the one who would say, has anybody asked if they drink? And it wasn't even a concept that people really thought about. So over the years, of course, it's changed. And Lisa, when you mentioned people taking the course, I teach an addictions, substance use disorder counseling. Many people in the class come for many reasons, right? I've had students say, I have family members who've struggled with addiction. I'm trying to understand it. There's a lot of my students who do that. Or I've had a nursing student join, and say, I think this could be important for me to know. What I found, and it's changed over the years, but really looking at the recovery part and, really breaking down and the stigma, and really talking about recovery-oriented, growth for individuals, and that recovery works. And that's the thing I talk about repeatedly in the class, is that it works. And what I have found over time is every now and then, the more we destigmatize, I have students who then volunteer their life experiences. and offer a lot to the classroom. If somebody's having some negative response to, for example, methadone treatment, I'll have a student in the class say, I'd like to add something of how that really, I feel, saved my life. And it really adds a richness to the class environment.
Yeah.
Good.
And I just want to chime in kind of as an adjunct to what Lynn just talked about, not everybody that comes into our classes or that, get exposed to this material is looking to be a treatment provider. Mm-hmm. And so, we keep that in mind, but the logic or the rationale behind all of the work I think that we've done around addictions up there, and I'm going to probably, give you a capsulated version, is we train social workers, psychologists, nurses, criminal justice majors, people that are entering all kinds of professions. Our thinking is they're going to interface with this population. So we think it's better that they have some understanding so they can do their job better, whether they're a probation officer or whether they're a social worker or whether they're in private practice. The more you know about addiction and recovery, thank you, Lynn, for bringing that into the conversation. So I went to Anna Maria 10 years ago as a faculty member, and at the same time, a book I had written was being published and kind of told my life story about my addiction, my recovery over the last 37 years. And so I went to my dean and told her about it. I didn't want her to be surprised by it. And she said, you might want to discuss it with the president, which I did. And in that same conversation, I said, how is it that the only thing we offer here is, drugs in society, courses like that I'm not sure how populated or popular they were at that time. How come we don't have a real focus on addiction, given, we train all these different disciplines and professions that are going out and entering the workforce? How come we don't have that? And I came out of Boston University and cut my teeth at the Center for Addiction Studies there. And so we started to have conversations, and then that's where I met Dr. Pratico, and, we put our heads together and really started to put some meat on the bones to develop this thing, to broaden our selection of offerings, really focus on those, like Lynn mentioned, that are taking those courses that do want to be treatment providers, aside from those who just, they might be looking at being a police officer or some sort of law enforcement person that just has an interest in it. Because everybody knows that, you can't have a conversation with anyone who hasn't been affected by this or impacted by this.
Right.
And so, the wider we broaden our net, I think the better off we are. Students have really shown an interest. And that's what, when John and I started to think about, what else could we offer besides there was a drugs in society course offered through, I don't know, humanities or something. And there was a course looking at, sort of drug importation through South America or something like that. And, and people took those courses, but John and I got together and said, let's really design something. Yeah. So we started to design courses that students were interested in. And the more that we did that, and the more that students were exposed to that, the hungrier they became and wanted more. And so we've continued to develop more, and we've set up internships, ways to help fund that, creative ways to help fund that for students that are interested in entering this profession and working with the addicted population. I've been doing it for almost 40 years, and, I have seen a lot and see a lot. And so I think what we're doing is right on target. And again, when I came from BU, they had a center that focused on addiction studies. Nowhere in the 10 colleges or 11 colleges in Central Mass was anyone doing that. And so I said to the president, how come we don't do that? And so we've really, again, made a concerted effort to focus on that. And students have responded, and no big surprise. And so my hope is it continues to grow.
Yeah, of course. And thank you, James, for that. That's personally shocking that, this even 10 years ago was not thought of, or, not really being applied the way that it is today. And, to your previous point, John, about, you don't care if someone's an LMHC or LICSW or human services. My background is I came into this work through lived experience, but also with the human services background, and then found my way toward the LMHC degree. Yeah. I think it's important for anybody listening here that regardless of degree or population, James, you said it, they're going to interface with this population at some point. And to have the most beneficial information or resources available it is only going to help not only the provider in their professional growth, but also whoever they're sitting across from as the client or the patient. So I'd love to just talk a little bit about not only for the listener, but for my own personal interest of, I know Anna Maria College and Spectrum Health Systems has a rich history and goes back quite a ways, but maybe Lynn, if you could kick us off, seeing how you have a foot in both worlds, just of how, one agency sort of helps the other and how that relationship has been either formed or continues to grow.
Well, certainly I think through, practicum and those kind of things, right? So that's where Spectrum certainly and Anna Maria have really joined with more internships, kind of still going back. I used to early on, and John will probably agree that there's been a change over time, but initially it was exactly a little bit what Jim was just saying, that the students came in. I often was doing the sell job of no matter what you do in your profession, you need to have some base in addiction. They may have a family member, they may have, whatever. And then people are like, oh, okay. Or they thought, am I narrowing myself as a profession if I specialize in addiction? And it's like, nope, that's one part of the DSM. And then there's the whole field that you are going to continue to work with. So I find today's students still some fall in that category, but it's very purposeful with a number of them now. I think the opioid crisis created a lot of that as well. There are so many people impacted that a lot of students want to understand more. So I have a different kind of student than I did. I've been teaching at Anna Maria, I think about 12 years, and it's changed a bit. But what we can do is you have then more students who start a class and say, I don't want to do anything in this, but I thought it'd be interesting, who suddenly want to do an internship when it comes to internship time. So I think learning more in the classroom makes people maybe wanting to extend to that out in the clinical world, which again, Spectrum having outpatient and inpatient services, we can place people in a number of settings that can help them get that foundation of finding out, is this what I want to do? And, and stay within that field. And John, you probably have comments with that.
Yeah. Oh, yeah. I was writing down some notes. Well, and one thing to note is when we're talking about internships with Anna Maria, we have undergraduate and graduate students. So what's nice about that from an agency or provider perspective is that, sometimes we have programs where we just want the students to get exposure to the field. So there's a lot of shadowing and there's a lot of indirect service interactions. Shadowing groups or, co-facilitating. And for some agencies, that feels really nice because it's like, we don't feel exactly comfortable having a student with this level of education or training to go and directly be doing work. But then there's other programs where that's exactly what an agency is looking for. And that's where the graduate students and the advanced undergrad students come in, because our LMHC and MSW students are doing hundreds of hours of direct clinical work. Where they're directly doing intakes and individual and group and family therapy and on and on and on for licensure. So that's one really nice way that the colleges in Central Massachusetts interact with the agencies in Central Massachusetts through that field experience. And Lynn's point about stigma is a really good one. I was chuckling because the course that the graduate course she currently teaches used to be called Counseling the Alcoholic.
Yes.
And then it changed into counseling the substance abusing client, and then it's substance use counseling. So just that the course title in itself just shows the shift. And I remember being a grad student and working out in the field and working with individuals where the model at the time was you can do mental health counseling or addiction counseling, but they do not cross paths. And I distinctly recall being an intern at an agency where I was working with an individual with schizophrenia who had experienced a relapse, and he disclosed that in a session, and it immediately triggered a whole referral process to an addiction counseling site, because the site's policy was that we do not work with individuals who are in active addiction. If they are, they need to go to Spectrum. They need to go to some other, addiction counseling provider. And then if the person can be demonstrating X amount of time of sobriety, then they can come back. Which, when you look at it, it's like that makes no sense whatsoever. It's like,
sense. And I just really appreciate, the college and university role in changing that narrative, right? If you can present at the point where individuals are students, just like what Lynn just said, right? We're looking at one diagnostic and statistical manual where you're going to find all of the diagnoses for substance use disorder and all of your diagnoses for depression, anxiety, psychosis, all of those are in the same spot, and they interact with each other, and you have to treat both at the same time. And if you can start that conversation, one, you're actually going to get, I think, some students who were, interested particularly in mental health conditions and mental health symptoms, starting to see that interaction and see that they can be an effective therapist for both conditions kind of at the same time. And you can destigmatize that, right? When you think about the chronic brain disease model and really kind of making sure that that's at the forefront of the way that we are teaching that I do a lot of work with UMass's Child Trauma Training Center and a lot of trainings. In fact, I have one to do tomorrow with some care coordination staff looking at that interaction between trauma and substance use disorder, right? And the way that it impacts the brain in very similar ways, and how that makes recovery from both more challenging. Like just starting to get some energy for students to recognize that regardless of which kind of program you go to, right? Whether you come to work for Spectrum, which I hope anyone in school now listening does, right? We need you, but also, or any other substance use program, or you work in just an outpatient counseling center, that you really, have to be able to treat both, right? That you have to look at both at the same time. And so that, it starts at that education point, right? And really breaking that down. So I just really appreciate that perspective.
Well, I mean, that's a big shift from DSM-4 to DSM-5. Any clinician who was trained under the DSM-4 model knows that as we shifted to DSM-5, the sensitivity to overlapping symptomatology and the appreciation for co-occurrence, that was one of the big stances that changed. I wanted to pause. I have to do like some shameless plugs. I feel obligated to do some shameless. So one thing you had mentioned, Lisa, about, like the we need you to come work. There are so many agents, because I hear this a lot as a dean, where people will contact me and say like, hey, we have a job posting. This has been an unfilled position. You have a bunch of master's level students graduating soon, let them know. So one of the things that the social work and psychology programs did at Anna Maria was apply for a federal grant through the Health and Human Services division. So those who are familiar with HRSA, there's a behavioral health workforce expansion training grant that we were fortunate to receive, and it allows us to stipend 29 graduate students a year during their internship years. So we just did our first cohort last year, and Jesse and Lisa, you probably, I know I certainly think about my own graduate training, where I got to have received a $10,000 cost of living stipend, because we can do $10,000 stipends for 29 students a year for their last year of MSW or LMHC training. Any clinician who has done that work knows you're talking about hundreds of hours of internships. Some agencies will pay their interns, most do not. So, to ask somebody to, basically donate hundreds of hours of their time for the clinical training they need to do their job is a huge financial barrier. So that's one of the things we felt was really critical for our programming, was to provide some type of financial support through grants. So that's one thing we're doing on our side. Jim knows when we got started doing this work, we applied for a couple of local grants as well. So
Right.
That's where through the Reliant Foundation, for example, we were able to develop many of the courses that Jim was talking about, because it often boils down to money when it comes to these kinds of things.
And it's a two-way street. You had mentioned earlier, John and Lynn both alluded to, and Lisa as well, about, the sort of shortage that we face of good, qualified, competent clinical staff in this field.
Yeah.
And so the internship is a lovely segue into this, and it's a two-way street, or it benefits both parties. I know, I'm one of the partners in a outpatient day treatment program called Lake Ave Recovery, and we have had interns here from Anna Maria that have worked out wonderfully. We actually just hired one of them full time, and he was, I think, one of the beneficiaries of the grant money that John was just describing. And he's a wonderful addition to our clinical staff. We have, another one who was not part of an internship, but was trained at Anna Maria, a former student of mine. Actually, we have two clinicians on staff that are former Anna Maria students. The training is solid. And so, for employers like myself to, search for good, qualified, competent staff is a challenge. And having that introduction through internships, field placements, is a great way to sort of, segue into that process. And so I'm really grateful that we have that relationship with Anna Maria. And I've worked with John and Lenore and the rest of the faculty there. So we always talking to each other about, who do you know, or do you know anyone who needs an intern or that could have a site for this person? It's a small enough school that we get to do that, and fairly informal too. Yeah. And so most of the work John and I have done is informal, I think, over a cup of coffee. You know what I mean? And I think that's some of our best work, actually. So I just want to make sure we bring that piece in, how important it is for employers and potential hires or clinicians.
And we have to make it easier, right? We have to make it attractive to do this work, and internships are vital. In order to be a good clinician. Like, I believe strongly in that, and in training our interns really solidly, so that they can take that learning from the classroom, apply it to the real world, and become competent clinicians. But it's not easy to do. Like, as you said, John, I can so clearly remember what that was like, right? Going into work, and I was working at Spectrum at the time as a manager. I forget what my exact title was at the point, but I'm going in at like 7 a.m. because it's an opiate treatment program, and then leaving to go do my internship from 10 to 3, and then coming back to work and working on the weekends and taking classes. Like, that's not an easy feat. So any ways that we can make that easier, I also think that will help with some of the, not just general workforce shortages, but diversity in our workforce, right? Like, I'm coming from a place of privilege where that was tough and it was a blur, but it was possible for me. And it's just not possible for everybody. So if we're looking to really increase diversity in our staff, which is what we need to do in order to reach the populations that we need to reach that aren't coming into our doors, right? That we need to do things like that. I really appreciate it to make this process a little bit easier.
Yeah, absolutely.
Certainly. That's a great point, Lisa. Oftentimes I talk to people, whether they're in the field or not, and I tell them a little bit about, what that encompasses, and they look at me like, why would you want to do that? That sounds like too much work, or that's complicated or whatnot. And, just speaking from my personal experience, I've now done 3 internships at all various levels of care. And it is just, if anyone's listening and interested in, the work, or like, John said earlier, as we opened this episode, it doesn't matter, LMHC, LICSW, human services, you're going to be interacting with this population, and, to be in this helping field, each internship was distinctly different.
Yeah.
From a halfway house level of care to a detox level of care to a residential level of care. It's almost like a different world, but it's very unique and very personally satisfying that it's all under this one helping umbrella.
Yeah.
And, I guess that's a segue, just to talk about what we've already alluded to, where over at Anna Maria College, you guys are doing something I think pretty cutting edge. And, if I'm not mistaken, not too many other schools have done this, where this is I'll let whoever would like to describe it, but a complete degree in addiction and recovery studies.
Yeah. I'll start off and Jim, please jump in. There aren't that many programs that offer a full academic major in addiction studies. So Jim and I noticed that when we started increasing the number of addiction courses, that not only were they courses that students would say that they sounded interesting, but they were very populated, fully populated and consistently run. We have a full, like Jim said, we have a full gamut of courses now that introduce students to the topic of addiction and recovery, and then also have additional courses on addiction counseling. We're very cognizant of the fact that not every student wants to go and become a LADAC or a KDAC or do addiction counseling specifically, but they do want to learn about the topic itself. So that's kind of where we've led off. And it does make sense when you think about Anna Maria as a college to provide a major like that, because we have so many helping profession majors that are focused on community-based work. We have a course specific to the opiate epidemic, and that's a good example of a course that is not addiction counseling, but does provide students, with the history of opiate and opiate use. Obviously, it goes through like the 1990s and early 2000s with, that major wave of opiate use. The students are expected to get Narcan trained and go to a community meeting. So I think they have to go to a Learn to Cope meeting. And that just gives you a good example of like a typical course that the major would entail, right? Providing some basic frameworks, concepts, and some opportunities to get out into the real world in a reasonable way. Go ahead, Jim.
For many people, it's a starting point, like you just said, John. Regardless of what their career aspirations are. I'm teaching a course right now, an addictions course over the summer. It's full completely with law enforcement and criminal justice majors.
Yeah.
These are seasoned police officers. They are not going to become addictions counselors or therapists, but they have a need to know or a desire to know, because every day they are interacting with this population and frustrated and banging their head against the wall, with some of the things that happen and wondering why and how. Why doesn't this person just stop? We put him in jail 6 times. Why doesn't this person do? And so the more understanding they have of that, I think it helps them to do their job better.
Yeah.
And so, it's not a surprise. John and I, not that we're sort of omniscient, but John and I knew early on, because we could see the rhythm, or feel the rhythm that, it was more and more people coming forward wanting more and more. So we went from adding a couple of courses to developing a minor.
Yep.
And, so it's been this sort of organic evolution where students have continued to come forward saying, is there any others? I have students in my addictions courses that have taken the last 3 that I've taught.
Yeah.
I kind of look at them like, aren't you tired of me? You're here again. They just have this thirst, regardless of what their career goals are, to know more. And a lot of that maybe is driven by personal stuff. I actually, in my work bag that I carry around, I have a beautiful card that a student sent to me saying, once I sat in that classroom and heard the things that we were talking about, it all made sense to me. It comes from a long line of, substance use or alcoholism in her family system. And never understood it and felt the trauma, back to, Lynn's comment about trauma, had been traumatized by living with addiction for years and years and years, and sitting in the classroom, hearing us talk openly about these things that we all know about on this call, and maybe a lot of your audience does too, but she had never been exposed to it. And once she started to connect the dots, I think it helped her to realize, number one, this wasn't my fault that any of this happened, and started to understand how someone that she could love so much, like her father, could be such a, fill in the blank kind of person. She just didn't understand it. There was that sort of cognitive dissonance that it didn't make sense. Once this starts to make sense, I think I became hungry for it. When I first got sober, I knew nothing about it. I had no education. I just started to want to know what the hell happened to me? How did my life become a train wreck? Yeah. And the more I started to learn about it and get involved, the thirstier I became to learn more. And that's been like I said, a 37-year journey of learning more and now trying to pass on some of that knowledge and experience, not just from the sort of academic side, but from the personal recovery side. Not that I wear that on my sleeve, but, no pun intended, my life's an open book. People know what my life has been. And I try to use that for positive benefit or gain, as opposed to just, sensationalizing, what a crazy life I had. I try to use that to benefit people to understand this thing we call addiction or substance use disorders or whatever. And I think the students respond well to that. I have a great relationship with the students. The evaluations are always great, and that's not a tooting of my own horn. It's just, I think, going back to the point that they're lost out there in the midst of this, what we're calling an epidemic that's been going on a long, long time. It didn't just start 10 years ago. People have been struggling and suffering from substance use disorders as long as substances have been on the planet. We're now starting to talk openly and address it and not be fearful of the stigma or what's going to happen if I disclose personally that, I was an addict. I think people can plug into that and it helps them to understand this better, not just the addiction part, because you can read about that in a book or a well-written article. You can try to understand the addiction part. It's the recovery part that I think we've done a poor job at.
Right. We need more recovery stories. So I appreciate that kind of transparency, Jim, right? Like that your students can see that and that, they can see you as a professor at the front of the classroom, that, that those with lived experience. So, Jesse, finishing school, taking a supervisor role like that, that's what I think that the world, but particularly those who might be interested in working in this field need to see is, of course, there's the academic piece of how you get there, right? There's the opiate epidemic. There's the way that substances impact your brain. There's all of that. But then there's also, what does recovery look like? And really sharing that message that recovery is possible. And this can be a really rewarding space to work in, right?
Yeah. And sad to say, in our society, what we emphasize and what we overexpose is the addiction, slimy, sleazy part of addiction. You know what I mean? We don't highlight or showcase the recovery part, the beautiful part of somebody coming from, a shattered life or a train wreck of a life like mine and rebuilding it and developing it into something I can sit here and say that I'm pretty proud of. We don't show that a lot or enough, in my opinion. Mm-hmm. And that's really what prompted me and my colleague to write that book. And what prompts me to do a lot of the work that I do is I want to show people that we do recover. It's not a death sentence. It's hard, a lot of work, but we do recover. And so, I continue to do that or include that piece in anything that I do professionally, whether it's a conference or supervising programs and things like that. I think it's an emphasis that needs to be out there.
You're right, James. And to turn this around again, I think the theme that we're sort of all hitting on is talking to the person who maybe is, just graduating high school or just undeclared a minor or a major in college and, maybe kicking this thing around about, joining the field somewhere, that it is a beautiful thing to see people recover. And it is a inspiring thing. You talked about the card that you carry around in your work bag. And, for all the really difficult, challenging cases that, patients and clients pull at our heartstrings. There are those who, stay with you in memory forever because of the just amazing stories of, like the phoenix rising out of the ashes, right, where, you can't not be inspired by those stories, and to come to work every day and be surrounded by those stories of hope and resiliency. And, just in spite of the shared life that you talked about, pulling something out of that for good. I mean, I don't think any other field, I'm certain that, if you go to work, and I'm not knocking it, but this is the example I used, like an accountant or a banker, I don't think they're having the same conversations that we're having every day in session or, teaching a class. And I have to think it's something unique and really special to this field. Where we
have to do it. We have to do it because, and I hope this doesn't sound like I think it's going to sound, what we've been doing for the last 50 years or longer hasn't really produced great results as far as, really putting a dent in this issue. The amount, just look at the overdose death rates from opiates, has increased every year. And that number continues to go up, and the age group of that number continues to go down. So we need to do more. We have to understand this. It's not going to go away. And those of us that have been kicking around a while, I think, should be leading the charge and nurturing young students or professionals to want to become part of this, because everybody's affected by it. You know what I mean? And so no one's going to figure it out for us. We have to. And I emphasize that to my students is, I'm so glad you're here because, I'm kind of at the end of my career, so to speak. I've done what I can do. And now it's time that we turn it over and really depend on the youth and the young professionals entering the field to bring that energy and that perspective that's different than mine, to the work. And I think we all benefit from it.
I think one of the exciting pieces, and I think, Jesse, you would probably agree with this, coming from lived experience. I've taught in a lot of KDAC programs as well, where the majority of the class comes from lived experience, and often presented the class initially with the view of their own experience only, and where education comes in is really providing those evidence-based practices that we can implement to really make change happen. And it's wonderful seeing students really learning from those pieces and separating out, here's my opinion on how I think things should go, to, wow, there's really some evidence here that this works. And when they start using those practices at work or in their internships, it's like, wow, this stuff actually works. And so I find it, as a professional in the field, but also as an educator, very exciting to see that transformation happen. And it really does become exciting. I say I've been, more than 35 years in the field. To do it all over again, I do it the same. I would still work in this profession. I tell that to my students, and many of them do hear that. It's like, wow, you've been doing it this long and you still want to do it? I absolutely do.
Yeah. And I do agree, Lynn.
Like, I don't think we've had a single airing addiction episode where the word hope has not come up. Yeah. Right. Yeah. I don't think it's ever happened, which I think is just inherent in recovery. That really, in a lot of ways, it's directly tied to recovery, is that aspect of hope. And what I hear you saying a little bit, Lynn, is that part of the role of education is to support multiple pathways of recovery. And present evidence and allow even individuals with lived experience who might come from their own pathway to recognize multiple pathways and learn about all of them and really allow it to be, a patient-directed experience in treatment.
Yeah, yes, of course. And if I could add one other piece to that too, coming from lived experience, you're right, Lynn, I do agree with you sitting in those KDAC classes, although I wish I sat in one of yours because I'm sure those are great. I do agree that, I come from my own experience first, and then I learn all these other tools, and it is exciting. One topic that just comes to mind is motivational interviewing.
Yeah.
And I knew nothing of that, or so I thought, coming from, an alumni of Spectrum Health Systems and sitting in those MI and MET, motivational enhancement training led groups, but not knowing what that was. And then I needed to say this. I felt like I just wanted to flip it to anybody that is, getting sober or sober a little while. Mm-hmm. And, it's really common, at least in my experience, to want to go back and help others because A, it feels good. B, the need is so strong. Like I think a theme of this podcast so far has been, but, really the benefit that I've gotten in my personal recovery from the professional growth, learning about those multiple pathways of recovery that Lisa touched on. I tell clients all the time that I can learn from you. It doesn't matter that you're coming into detox and, you're starting this process again, or, you're X number of months into it in a residential setting. Is there a book? Is there another podcast that you listen to that, I can't tell you how many suggestions I've gotten. I've listened not only to learn professionally and better help others, but also, if you're listening to this or you're going to school in the helping field and you're also in recovery, just know that you're going to benefit from doing this work and you're going to grow in your own recovery.
We make a pretty concerted, Lynn and Jim can probably back me up here. We make a pretty concerted effort in our courses. Obviously, you've heard about the emphasis on destigmatizing language. So that's a big one. But self-care is another, it's something that you hadn't heard about. Certainly I didn't really hear about it when I was in grad school. And nowadays that's a really critical concept that comes up a lot. And it's especially important to discuss in the context of addictions coursework because I always tell students, again, I don't really care where you go, but it's like, I want the students to make a career of whatever path they go. I don't want them to make a job of it. So it's like, I don't want them just doing this work for 2 years and then burning out and then going and doing something unrelated. I want them to develop from the ground up the skills to be able to do this as long as Lynn and Jim have been doing it and continue to enjoy it, and continue to find meaning out of it and all that.
And continue to learn.
Yeah.
When you were just speaking, Jesse, about sort of the two-way street of that process, I recall recently over the last year, maybe 2 years, in one of my addictions courses, presenting sort of videos and articles around addiction being a disease or a choice, and I didn't know it at the time. But the articles and the video clips were all kind of pro. Yes, it's a disease. And a student who actually happened to be a CJ police officer wrote me an email and said, I appreciate the stuff you put in there, but know that there are other opposing arguments, and sent me a clip of a professor at Harvard who argued that, addiction is not a disease and, had whatever evidence that he had. And not that I had to change my thinking or perspective. But as far as presenting and teaching the material, if I'm only presenting one side, then I'm shorting students from getting the other side. So I said, send me that clip, which he did, and I included it. So now I have them watch both sides and let them make a decision or a determination about what they think based on what they've heard and seen. So there's always room for learning and for growing. Even though I've been doing this, I consider myself an old dog in this business. There's still time and room to learn new tricks.
We like to think that we're part of a paradigm shift. It sounds pretty lofty, but one example of that is we have this new project that we're kicking off in the next year, and it's a pretty big project that's involving us being the hub and training center for what's called mental health first aid, which for those of you who don't know, it's kind of a day-long training, gives a very basic layperson's appreciation of mental health. And addiction is a huge part of that training. That's one piece that gets folded into it. And we kind of chose to pursue this project because we want to have it targeted to the public safety professions. So the idea is, you'd have people like me can come into a room and, talk to police officers, firefighters, paramedics, EMTs about mental health and addiction, but it makes more sense to have, public safety professionals doing the training to their peers. And then you got a guy like me, sometimes wearing a bow tie or whatever, sitting there to bring the mental health side. But that's one example of where we're trying to think, okay, if we can get individuals to change the framework of how, so let's use law enforcement as an example. If you can help a police officer help his peers or her peers become cognizant and aware that mental health and addiction is not something, that's certainly going away. But if you can reframe it, it'll allow you to, it'll make your job easier. I mean, most police officers will tell you that a significant portion of their calls they receive have and relate to addiction and mental health.
Yeah.
And yet at the same time, many police officers don't have the training on how to talk to people who struggle with these concerns. So that's one of the things that we're trying to do on our side. It's just, again, Jim's point, his summer course is largely populated with people who are not human service professionals or students.
But none of them are, John.
Yeah.
They're all CJ folks.
Yeah.
That's great. So I know we kind of promised to keep us to like a 45. We could actually talk all day, which is fun.
Oh, I thought we were just getting started, Lisa.
But I think, we've touched on a lot of great themes of, providing good education, good focus in the addiction space for all levels of staff. And so one of the things that, we tend to do on this podcast is ask our guests to share any resource that you would share. And I think I'd love to take the spin of a resource that you would share for like an academic resource on addiction, whether it's something that you give in your courses or, that somebody who's just interested in learning more might like to read, whether that's a podcast or a book or an article. Is there anything that comes to mind for any of you that you would share that we could put in our show notes?
Yes, I'm trying to. I have the issue of like too many, so I'm trying to just give you the
trying to narrow it down.
All right, so if I had to pick just one, and we're going like purely academic, I would probably encourage people to look at something along the lines of motivational interviewing.
Yeah.
Going to Jesse's point, because a large part of MI started with addictions work, but anyone who's stuck around long enough knows that model gets applied to any kinds of behavior, and usually habitual behavior. So I'd say if you're just going to go with a non-addiction related thing, just look up and read about that. And I would try to steer clear, to Jim's point, I would try to steer clear of addictions related texts that stay so focused on the grime that you don't get the recovery side of things, because it makes for entertaining movies, it makes for entertaining TV, but it doesn't really, they don't often provide a nice framework for the recovery side, which is what I tend to try to align myself with. So that would be the two.
And of the motivational interviewing books, I think William Miller's first book on, motivational interviewing, it's older now, from the 90s, but I can recall literally reading it in the summer on the beach as a clinician and saying, this has been how I've thought about the field for so long. When early in addiction, everything was confrontational. People had to be ready, and obviously they're not, so they can't be in treatment. And that book for me was, first validating the approach I had, but also really gives you the feel of what can work in the addiction field. So I would agree with that. And with my students, I do the SAMHSA website a lot and the TIP protocols. But the whole SAMHSA website has so much information about addictions and learning more. And it's really integrated in my classes now that I do pieces of that out of my classwork.
Wow, that's a tall order. And as I'm listening to people, I'm thinking of a million things that I've seen and read and over the years. I search all the time for really relevant, up-to-date, good, solid textbooks and material to use in my classes. And what I find myself doing is reaching back to yesteryear to the stuff that I cut my teeth on. Mm-hmm. And my logic and reasoning for that is because it's good, solid information. And, I'm talking about the sort of Claudia Black, John Bradshaw stuff. That's when I came onto the scene. And those folks wowed me. And, when I'm trying to present some of the material in my classes, I use articles from those folks because I think they really take a very complex issue and describe it and break it down in a way that even someone like me could understand back then, and had no prior education around it, and didn't understand it, and I just could sort of sink my teeth into it, and it helped guide me and it helped educate me. I watched all of the Bradshaw on the family PBS series there was. It was like I was addicted to it, because it was just so interesting and so full of information. So I go back to those folks. Ed Kansian out of, I think he was at the Cambridge Hospital and the Harvard system, wrote a great book about treating addiction from a human perspective. And I love that because, all the stuff we've talked about, the stigmatizing and the sort of way that we've understood and treated people with addictions. And Ed's book is about really treating someone like a human being and not an illness. And that's, I think, really important to keep in mind, that before they have this condition or illness or disease or whatever you choose to call it, they're a human being first and foremost. And we need to hold on to that. And so those are things that I think really help me. There's newer good stuff that's, Maureen Kavanaugh's name came up earlier. Maureen wrote a great book called If You Loved Me, about her struggle with her daughter's journey.
Yeah.
We've had Maureen on twice. And the great thing about this podcast is the varied perspectives. And so, I'd like to encourage, one of the things that's come up a lot in this conversation is the need to give kind of varied perspectives and multiple pathways and recovery stories to those that are learning about addiction, whether they're going to become a treatment provider or not. And, even podcasts like our own, right, that have people from various backgrounds, in talking about multiple concepts of addiction, lots of recovery stories. We've had individuals, on long-term medications, and being able to share their recovery story to break down that stigma. Individuals who've taken multiple different kinds of pathways to get where they are, as well as professionals like you all, right? On this podcast. So kind of just listening to those stories and taking all of those perspectives. And I guess probably a decent segue to ask our listeners, right? Jesse's usually the one that does this because I forget all the time. But,
yes.
Subscribe. Jesse, you want to take your spiel?
Yeah, subscribe. I mean, I know I'm personally thrilled at this conversation and can't wait to listen back to it. I've been, like I said at the beginning, really excited these last couple of weeks putting this all together. And if you're out there and you're listening to it and you just want more of it, who knows? Airing Addiction has been known to do follow-up episodes. We certainly did with Maureen Cavanaugh. And, those listeners who listen to those know the impact that she had on our agency at Spectrum Health Systems and the changes we've done. So subscribe, Facebook Live. We try to get this message out there as much as possible to help people and, again, to share the hope. So I wanted to thank you, Lynn, John, and James, for joining us. I really do wish we had more time, but looking at it, I think we've gone the hour, and I thank you, everyone, for listening. Until next time, thank you, Lisa.
Thank you all so much.
This again.
Thanks for joining us on Airing Addiction. We'll see you at the next episode.
Thanks.
Bye-bye.
Thank you.
Bye-bye.